of the biggest challenges we faced as an organization, and particularly as a director of critical care, is dealing with the sometimes overwhelming numbers of patients coming in and how to provide care for them safely. At one point, the ICU had to be turned into an isolation unit, and we had to open a clean unit in a different area of the hospital. And every department came together and really worked hard to make that happen.
My biggest challenge at the beginning of the pandemic was one I shared with all of my colleagues and probably a lot of people in the community, and that was uncertainty and even some fear about what we were dealing with. As we were beginning to get reports out of China and even out of Italy and Europe, and then in the US, as we were hearing what was happening in New York and other parts of the country, we were wondering if we were going to experience similar super challenges. I mean, the challenge, just the intellectual and emotional challenge of uncertainty and fear is different than actually having to face the day-to-day challenges that those folks were experiencing. I think we met that challenge through camaraderie and support. We were all going through it together, and misery loves company. But not to be glib, I think having other people with you, having the support of other people. The hospital was great with providing enough personal protective equipment so we felt safe. Our colleagues we were looking at each other, making sure we were adhering to the proper practices. And actually the uncertainty and fear lessened as we began to deal with patients and realized we could do that safely. Nobody in our department got sick with COVID as a result of taking care of patients. And I think that's a testimony to how that support and camaraderie got us through that.
Mental health is always an important topic for nurses and healthcare workers. We're under an incredible amount of stress, and we take care of people at their worst, the worst time in their life, their highest points of crisis. And it's hard not to take that home with us. So when we are experiencing difficulty in our own life on top of what is going on at work, it's very challenging. We did encourage our staff to try to take time for themselves, eat right, exercise, decompress. We did a group therapy session, and we did encourage our staff to use our mental health services that we have available to them. And now I think we're all still recovering from that time and getting back to our healthy work-life balances.
Achieving balance between being a first responder and being safe and keeping my family and loved ones safe actually wasn't much of a stretch in my family. My husband's a surgeon, my daughter's a nurse, and my other daughter is in nursing school. So we all were able to participate in this together, and we're very careful about removing our clothes and frequent hand washing, social distancing, and we all got vaccinated the moment we could.